an x-ray? Take a number. But feel free to wait in your own living room because there's a new service that some hospitals are using to let patients pay to make an appointment at the ER. So will the initiative really speed things up in the ER or just create more problems? For a fair and balanced conversation, we're joined by spokesperson for the Coalition to Protect Patients' Rights, Dr. Donald Palmisano, and Dr. Robert Steele of Loma Linda University Medical Center out in California. And Dr. Steele, you at your University Medical Center have already had 400 patients use this. Why do you think this is a good idea, where you could pay $25 in advance to get an appointment?
Well, here's the thing, is that most people don't realize that emergency departments are overcrowded, they're busy, they're places that are impacted. But actually, if you look at a 24-hour clock, there are times when the emergency department is actually slow, where there's not a lot going on. And what we have the ability to do with this service is we actually have the ability to shift these patients just slightly, either before or after the busiest time. And in fact, what we're able to do is we're able to allow these people to start the rest and restorative process that helps them to heal, and they can do it right there in their waiting room. All we're doing is shifting where they're waiting. And from our side, what we are allowed to do is we are now allowed to control that surge just a little bit. It makes us more efficient, makes us more lean, and actually allows us to provide better service to these patients.
And you know what, Dr. Palmisano, because as somebody who has spent half a day in an emergency room with one of my kids, you know, I'd be willing to pay $25 because if the hospital doesn't see you within 15 minutes, you get the money back.
Well, Steve, certainly in the land of liberty, in the free enterprise system, the doctors and the hospitals ought to have the right to contract with patients. Unfortunately, what is happening and the need for this particular service shows that it's a symptom of a broken health financing system. So this is just a symptom. And I have two concerns with this technique. Number one, it's the same physicians and nurses taking care of both groups of patients. And so it's like someone driving an automobile and trying to text at the same time. They may be diverted when they should be with that person with the gunshot wound or auto accident victim and so on. So what the second concern, but the second concern, let me just finish the second point. I'm also a little concerned we're over-regulated in this country, and this new health care law is going to make things extremely worse, and so much worse. And so what's going to happen now is that what happens when a Medicare patient calls or a Medicaid patient?
Excellent point.
We're price fixed right now as physicians.
Let me get Dr. Steele in.
You may be violating federal law. Yes.
What about the problem, Dr. Steele, where you're encouraging people who don't need the ER to use the ER?
Well, that's a really easy thing to say retrospectively. So one of the things that we find is that every study that's looked at inappropriate visits to the emergency department is almost always done retrospectively. Well, that's really easy to say. So what happens is you're sick, you come to the emergency department, and we say you have a cold. Somebody looks at that later and says, well, that was inappropriate. You had a cold. Well, 1 out of 100 of those patients turn out to have meningitis or a very sick illness.
This is such a good debate.
Actually, those patients...
Right, exactly.
There's a big difference.
Delighted that you two could both join us to talk about it. Dr. Palmisano and Dr. Steele, thank you very much.
Thank you very much.
Thank you.
All right. What do you think? Good idea, right? We'll be back in 2 minutes. Stick around.